Hello, Namaste and welcome to Ayurveda Mentor. In this video, I'm going to discuss with you about symptoms of hypo and hyperthyroidism. These two are common problems of thyroid gland, and thyroid is related with metabolic well-being. So, we will go into more depth about the symptoms of thyroid problems and how these symptoms can be perceived in the light of Ayurveda Doshas or Vata, Pitta, Kapha. As you can see in this picture, thyroid gland is located in the throat area below Adam's apple, and it is the seat of metabolic well-being. Thyroid is very closely associated with modulating of basal metabolic rate. There are two problems or two conditions related with thyroid. The first one is hypothyroidism, where there is poor functioning of the thyroid gland and basal metabolic rate goes down. The second condition is known as hyperthyroidism, where metabolic rate goes up. As you can see, there are three main hormones that are secreted by thyroid gland. T3 and T4 are closely associated with basal metabolic rate. Calcitonin is associated with calcium metabolism. When doctors generally prescribe thyroid profile or blood test for thyroid functioning, these contains T3, T4 and TSH. This picture tells you one very important fact about control of thyroid hormones inside our body. When we say control, one thing comes to our mind. All of the body systems are controlled by nervous system, and some glands are controlled by neurohormones, or when nervous system and hormonal system or endocrinal system it meets, we have neurohormonal control center, and it lies inside our brain. So if you see it in relation with thyroid gland, you will find that thyroid secretion, the hormones that are secreted by thyroid, T3 and T4, these are influenced by certain neurohormones, or you can say higher centers. Then there is thyroid gland, and at the tertiary level, at the third level, there is influence from all the body tissue and various other glands like adrenal glands, pancreas, sexual glands. We will go into more detail about them. In this picture, there are two neurohormones, two higher centers that are controlling the release of thyroid hormones from thyroid gland. The first one is hypothalamus. It secretes TRH or thyrotropin releasing hormone. This is the primary control center. Then this TRH goes into pituitary and it secretes TSH, thyroid stimulating hormone. TSH is a kind of thyrotropin that is affecting the thyroid gland to work. When TSH goes through the bloodstream into the thyroid gland, it stimulates thyroid to secrete T3 and T4. And there are additional controls, additional feedback centers. These are adrenal glands, sexual or reproductive glands like ovaries in women, testicles in men, and pancreas and liver. These are other glands that are directly and indirectly influence the secretion of hormones from thyroid gland. Now it's better to go into more depth about the symptoms of hypo and hyperthyroidism. As you can see in this graphic, hypothyroidism has these symptoms: dry and coarse hair, loss of eyebrow hair, puffy face, enlarged thyroid gland, slow heartbeat, arthritis, intolerance to cold, depression or low mood, dry skin, fatigue, forgetfulness, heavy menstrual periods, infertility, muscle ache, weight gain, constipation, and brittle nails. As you can see, all these symptoms are associated with poor metabolic rate. In hyperthyroidism, there is excessive metabolic rate, more than normal, and the symptoms are generally opposite of hypothyroidism. You will find hair loss, bulging eye, sweating, enlarged thyroid. It can be present in both conditions: rapid or fast heartbeat, difficulty in sleeping, intolerance toward heat, infertility, irritable behavior, muscular weakness, nervousness, poor menstrual flow, weight loss, frequent bowel movements, warm, moist palms, tremor of fingers, and soft nails. And if you see the clinical representation, if you put your hand like it and put a piece of paper here, and the person who is having hypothyroidism, there will be pronounced tremors. You will see the paper moving, paper trembling along with fingers. So this is a prominent symptom, and these symptoms are very much general or generalized symptoms. Most of these symptoms are not very characteristic of thyroid related disorder. But if you see the picture of all these symptoms and you put the prominent ones into light, and when you see all these together, you suspect the thyroid problems and you have the blood test for thyroid profile. When I reflected upon the symptoms of hypo and hyperthyroidism from the Ayurvedic perspective, from the perspective of three doshas or Vata, Pitta, Kapha, there is a strange pattern and you will appreciate it. As you can see in this picture on the left side, for hypothyroidism, the symptoms are related with Vata and Kapha. Vata and Kapha both are involved. If you see the properties of Vata and Kapha, these are represented or reflected in all the symptoms on the left. On the right, there is hyperthyroidism symptoms, and you can see the qualities of Pitta and Vata there. And as you know, in most of the chronic disorders, there is association of Vata. It is Vata that moves both Pitta and Kapha. So it is associated. And in many of the conditions of thyroid that are autoimmune in nature, there is a concept of avrit dosha or covered dosha. This is little bit more complicated to understand for the normal persons. But if you see the symptoms, you will find dry and coarse hair, very much characteristic of Vata symptoms, Vata and Kapha. Loss of eyebrow hair, puffy face, again Vata and Kapha. Enlarged thyroid gland, Vata and Kapha. Slow heartbeat related with Kapha. Pain in joints, Vata. Cold intolerance, both Vata and Kapha. Low mood, Vata and Kapha. Dry skin, Vata symptoms. Fatigue, symptoms of both. Forgetfulness or mental fogginess, symptoms of both Vata and Kapha. Heavy menstrual flow, Vata symptom. Infertility, muscular ache, Vata symptom and Kapha symptoms. Weight gain, again Kapha. And constipation, Vata symptom. And brittle nails, again a symptom of Vata. So you see that in hypothyroidism there is mixed symptoms of both Vata and Kapha disorders. In hyperthyroidism you will find hair loss, very characteristic of Pitta symptom. Bulging eyes, Pitta symptom. Sweating, Pitta symptom. And enlarged thyroid gland, both due to Vata. Vata is there and it is causing irregular growth of any organ or any gland. Rapid heartbeat, symptom of Vata and Pitta. Difficulty in sleeping, Vata and Pitta symptoms. Intolerance to heat, Pitta symptom. Irritability, muscular weakness, nervousness, symptoms of Vata and Pitta. And poor menstrual flow, symptoms of Vata here. Weight loss, Vata and Pitta symptoms. Frequent bowel movements, again Vata and Pitta. And warm moist palms with sweating, Pitta symptom. Then tremor of fingers, Vata symptom. And then soft nails, This is again a Pitta symptom. So if you see the symptoms of hyperthyroidism, you will find a mix of both Vata and Pitta symptoms. It's important here to consider the role of autonomic nervous system in thyroid well-being. There are two parts of autonomic nervous system. Parasympathetic nervous system, it is responsible for rest, rejuvenation and digestion. It slows down our system. In hypothyroidism, there is activation of parasympathetic activity. In hyperthyroidism, there is activation of sympathetic nervous system. Sympathetic nervous system prepares us for fight or flight response for dealing with stressful situations. That's why you will find either one of them is activated in thyroid problems. So you can see that both types of thyroid problems, whether hypothyroidism or hyperthyroidism, are quite complex problems, and you can effectively deal with them through Ayurvedic treatment, Ayurvedic diet and lifestyle. And many times people are able to deal with these only with Ayurvedic herbs. And sometimes when it is very chronic and they are taking some medical drugs, they start Ayurvedic treatment along with medical drugs, and over a period of few months, they are able to have to reduce the dosage of the medical drugs. And if you have these type of problems, you can contact me, and we have some of the dedicated supplements that are meant only for thyroid well-being. In Ayurvedic domain, there are very few herbal supplements or Ayurvedic products that are developed keeping in mind the thyroid well-being, and Metalite is one of those. Finally, thanks for taking the time to watch this video. Adopt Ayurveda and yoga in your life. Have better health and greater happiness now and always. Thank you. Namaste.